Kilifi County is one of the counties along the coastal strips which has faced the adverse effects of climate change. It also experiences quite some challenges in terms of SRHR indicators. We've had high teenage pregnancies, sexual and gender-based violence, HIV rates that are somewhat high. We also have a trends with child marriages. So this particularly necessitated this intervention because climate change now accelerates some of these negative indicators.
We also see challenges in the more so the women and young people in terms of having that right to make decisions and the right to be free to take up the methods, because of the fact that we also have the cultural barriers that hinders. Most women around would say that they need to still seek for permission before they take up the family planning and maternal and newborn health services.
And Kilifi, it's a patriarchal society, so you can see that most of the favors or most of the things that are geared to a man, as in we concentrate on men than women. So when it comes to education, most priority goes to men and than women. When now it comes to sexual reproductive health, a lot of decision making, and it's not only sexual reproductive health, in all aspects of life, then the ones who makes decision the men.
Katika jamii hii ya hapa Uyomba ama hapa bandarini ni kwamba ilikuwa imedorora, maana wamama wa hapa na hata wazee walikuwa hawafiki hospitalini kwa huduma. Ndio tukapeleka malalamisho kwamba hii jamii haitoki, ndio ikabidi kwamba hapa kuletwe outreaches, tukaleta dialogues ili wahamasishwe. Na pia kulikuwa kuna wamama wengine ambao pia walikuwa wana shida ya mambo ya kansa. Kwa hivyo tulivyoleta huo ujumbe wakapokea, na wengi hata wababa pia walienda kupata hizo huduma ili wajue afya yao vile ambavyo ilikuwa inaendelea.
The project works through a multi-sectoral approach where we have different departments from the county government, that's the fisheries, health, youth and gender, and environment departments, all coming together to bring their expertise to address these challenges. We also work through the communities, through the community engagement to build their capacity to hold the duty bearers accountable and also to build their resilience. We do capacity building to these groups for sustainable development, as well as build the resilience of women and girls who are mostly affected by the effects of climate change.
We deal with the communities that are involved in the fishing. That is we call them fisher folk. That's fishermen, fish traders, and boat owners, and also other stakeholders who do different activities on the beaches. We organize them into groups. We call them beach management units. So they are anchored in Kenyan law, in the Fisheries Development and Management Act, and the BMU Regulations 2024. Gender is a big dynamic when it comes to fisheries, especially in the capture fisheries sector. We'll find that the different groups or stakeholders I've mentioned, for example, the fishers, the fish traders, and the boat owners. Generally, you'll find that the fishers are mostly male, and then the fish traders, you will find it's female dominated, where we have the mama karangas. That's what they call themselves locally, but they get fish from the fishermen, and they sometimes fry it or sell it fresh as it is. In terms of SRHR, there's a dynamic, as I said, with the fishers being male and the fish fish traders being predominantly female, there's an issue because the fish traders get the fish from the fishers.
Samaki akiwa ni kidogo, unapata ule mvuvi wakati mwingine inabidi anakulazimisha, anakuambia mimi nakutaka, basi ukinikubalia hata nikitoka na kilo 1 ama kilo 2 mimi nitakuwa nakupea wewe, lakini tu nikae na wewe kimwili. Sasa inakuwa ni ngumu, yani inakuwa inakuumiza. Hata huenda labda pia ukikaa na yeye labda hata ni mgonjwa na kuambukiza maradhi ya zinaa.
Working with the fisheries department is a critical aspect of the program because they get to regulate the fishing activities. For the health aspect, we are addressing SRHR challenges that are mostly affected by climate change, and some of these interventions include organizing outreaches to these groups that we've engaged in the community, to go to where they are, because most of the challenges they encounter is accessing these services is actually a problem.
We were able even to reach out to the clients who are very far from the facility, and then also we were able to deal with the clients one-on-one, giving health talk, because we have some places like Uyombo, Timboni, they are far-flungs from the facility, and then they are near to the beaches. So we had some numbers of outreach where we conducted there, because most of them, when you tell them to come to the facility, they complain of maybe fare to reach the facility.
Sasa hivi kuna wengine wameelimika, hata ufikia wakati mtu labda kwa makubaliano na mmeridhiana, kwa sababu amekuwekea gongo la kuwa ukichukua hawa samaki basi nafaa nikae na wewe. Namwambia kama umeridhiana naye, inabidi unamwambia twende tukapimwe, nione hali yangu ya kiafya na wewe nione hali yako ya kiafya, ili tu ndio tuendeleze hii biashara, na akikataa basi inabidi muache.
Our partnership with the Center for Studies of Adolescents is mainly to work with communities to impart knowledge on the nexus between the environment and also health. So in this aspect, WWF comes in with the expertise around environmental conservation and how it relates to the health aspects, and then CSA come in to educate and raise awareness on issues related to health, and particularly sexual reproductive health rights.
Na pia kuna elimu ambayo pia imetusaidia katika hali ya upangaji uzazi, ambapo labda mtu alikuwa anakaa hivi akiangalia yuafuata kuzaa tu kwa nyumba, lakini vile wamekuja wametuelimisha, tumepata hiyo elimu na sisi tumeieneza kwa wenzetu, na kuna tusaidia mpaka wengine sasa tumeamua kupanga uzazi. Hata mimi tayari nilikuwa nasema mimi nitajipanga tu mwenyewe, manake hizi dawa labda nafanya tu kusikia ukilezi dawa unaweza patwa na pressure, ulcers, vitu kama hivyo. Lakini kwa sasa hivi pia mimi natumia family planning. Nimejaribu sindano imenikataa, nimejaribu tembe imenifaa. Kwa hiyo nashukuru.
Climate change has really impacted the ecosystems in terms of affecting their resilience to undertake the ecosystem services that communities benefit from. For example, for mangrove ecosystems, the communities depend on them to food generation in the aspect that fish breed in mangrove areas. Also, the mangrove ecosystems are also absorb the carbon from the atmosphere, therefore regulating the climate. So it's a very important ecosystem that we need to take care of. And that's why we work with the local communities to impart knowledge on the impacts of climate change and also enable them to be able to take care of the ecosystem so that they can benefit from the ecosystems.
So we are working with community forest associations to restore and protect some of the natural resources that exist within their localities.
Training ambazo tulifanya ni za mambo ya environment, hasa climate change, tukafanya mambo ya reproductive health, tukafanya mambo ya gender na gender based violence, tukafanya mambo ya fisheries, mambo ya fish kule baharini na mambo ya population. Kwa sababu climate change inakuwa caused hata na human, it can be human nature, kwa sababu inaanza na mambo ya deforestation. Watu wakikata misitu unaleta hiyo climate change.
Tunashukuru sana kwa hili shirika la CSA kwa kutupatia hiyo training, maana imetusaidia na pia imesaidia jamii yetu.
Na wakati wa drought unakuta kwamba kina mama pia wanaenda long distances, wanaenda kuchota maji, pia ina affect their health. So tunawafundisha kina mama na wale wote ambao tumekuwa pamoja tutunze mazingira, environment for our good health, kwa sababu ukitunza mazingira yako unakuwa na afya nzuri. Pia population, kwa upande wa population tuwe na families ambazo tunaweza kuzimudu, because tunaona mambo siku hizi resources haziongezeki.
We are very privileged to have worked with the Center of Study of Adolescence for the support that they have given us throughout the time that we've worked together, specifically for the development of two policies. One, the climate change policy, and secondly, they were very instrumental in the support as we were developing the Climate Change Amendment Act that was done and completed in 2023.
Tuliweza kuhusika sana na kutengeneza sheria hasa ya mambo ya mabadiliko ya tabia nchi. Tulipokuwa pale Kilifi, tuliweza kuwa na mikutano washikadau mbalimbali, ambapo baadaye hiyo sheria ilikuja ikapitishwa Kilifi County, ambapo kwa sasa hivi inafanya kazi Kilifi County. Ndipo sasa ukaja na kile kitengo cha kuandisha committee za climate change katika world level.
Climate change is very critical, and it is not something that we are seeing it at the world level or international level, but we are feeling it at our local villages, at our homesteads. These are things that we've never seen before, and they're gradually becoming like prominent in our villages, in our households. And the idea is we have to take action. And why it is important is because we have made it deliberate to make sure we don't leave anyone behind. In the effort to mainstream climate change across sectors, we want every department, every division, every sector within the government to make sure they are cognizant of climate change as they plan their budgets, as they implement their programs, and as they do everything, so that in the planning they have climate change in their minds. In their budgeting process, they make sure they factor climate change intervention in their planning and budgeting.
From the onset of the program, we've engaged the duty bearers, especially from the Ministry of Environment, in changing, or rather reviewing, the Climate Change Act. That's with the support of our partner WWF, which we were pushing for the inclusion of SRHR as a resilience strategy to adapt to the effects of climate change. However, we were able to secure help in broad, and going forward, we are continuing with engagements with all the stakeholders within the various ministries to ensure that SRHR and climate change integration is mainstreamed. And we are happy that in the newly reviewed gender-based violence policy within the county, SRHR and climate change has actually been recognized and will be given prominence in the new law that will come into effect.